My name's Richard. I'm a clinical specialist physiotherapist within the long-term pain management team at Derriford Hospital. We're quite a small team, and initially during COVID we were able to redeploy and help out in many areas in the hospital. For instance, our psychology staff deployed to support other staff within the trust who were struggling with all the challenges that the initial COVID waves had on everybody. We needed to re-look at how we were doing a lot of our services based on the challenges that COVID gave, because we weren't able to see people face to face. We took all of the programs we were running at the time and totally rewrote how they were delivered and the content, so we could run them via video conferencing. Interestingly, it's had very positive changes in some ways for the patients. Some people, particularly when they had significant anxiety-related difficulties, have found that the video conferencing groups have been much more effective for them, and they've been able to engage and make positive changes in their lives much more easily via using that method than they would have struggled if it was more face-to-face. In some ways it's improved our efficiency. There are some clinics that we've now converted all completely in the long term to virtual clinics because patients have found it much more easy to engage with. They've become more efficient, and actually in that way we're seeing more patients than we used to in those clinics. Equally, the fact that we stayed in touch for a long time meant patients felt listened to and cared for, and they didn't lose touch with their healthcare, which helped a lot of challenges around anxiety and depression and other mental health difficulties, which were obviously a significant worry through the COVID periods.
The Zoom format, actually, it took away a lot of that anxiety. There was, you didn't have to be anybody but yourself. You were in your own safe space, in our own homes.
I got so much out of the programme, absolutely loads. It's been a journey, it's still a journey. Still doing loads. I've learnt loads of tools from the pain management that I use every day in my life now.
I think before I was really struggling to accept the idea that I had chronic pain. I kind of thought that somewhere there would be some kind of magic bullet and that one day I would wake up and be normal. And I think kind of having done the course, I've really kind of come to terms with all of that now. It's taken quite a long time, but I can see a way forward now where I know I've got pain, but I can still live my own life alongside it. And I've managed to kind of tone it down. So it is annoying and it is there, but in managing triggers, in living the best life that I can despite all the kind of limitations, so it no longer kind of frightens me, the thought that I'll be like this for the rest of my life.